Hi, my name is Dr. Tom Rofrano from the Natural Medicine Clinic in Palm Beach Gardens, Florida. And today I'm going to talk to you about Candida Curse-is yeast ruining your health? And this is something that we're going to go over basically some basic symptoms of yeast overgrowth, how to find out if you have it, and then some solutions for you to help you get better. So I've been practicing over 30 years now. I've been doing chiropractic, nutrition, functional medicine, and this is a typical patient I would see. So this woman came in a while back, 38 years old, complaining of fatigue, abdominal pain, bloating, gas, belching, indigestion, constipation, diarrhea, nausea, eczema on most of her body, irritability, mood swings, PMS, headaches, dizziness, itchy eyes, dry skin and hair, easy bruising, chest pain, hyperactivity, sinus congestion, rashes, itching, food allergies, hair loss, frequent urination, recurring yeast infections, sugar, bread, and alcohol cravings, and insomnia and brain fog. And that's more of a typical patient that I see. So she had seen many doctors over the prior 10 to 15 years. She had urged her allergist. She had been to many different specialists. Finally, she got her allergist to test her for celiac disease. And sure enough, that was positive. And so she went on a gluten-free diet. She started feeling better, but she still had all those symptoms. She temporarily felt better a little bit, some of her gut issues, but she still had all those other symptoms I mentioned. And she was soon back to just feeling terrible. So she found our office, did some thorough, did initial evaluations, some thorough testing, and found out, amongst other things, and typically when someone has all these things, it's just not one thing. It's usually a multiple of things, but one of the main primary things going on here was yeast overgrowth, Candida. So yeast is a type of fungus, and Candida albicans is the most popular type of yeast. And normally we have a normal amount in our systems, in our gut, but when that gets out of balance and overgrown, that's when you can get all these symptoms. And one of the most common causes of this is antibiotic use. I mean, even one course a week of antibiotics can wipe out your healthy, good bacteria for months and months, and just that allows yeast overgrowth and all the bad bacteria and yeast to overgrow and kind of take over. So there's antacids. So many people, one of the most prescribed drugs in the United States are antacid, acid blocking drugs. And if you look on their side effects, one of the primary ones is yeast overgrowth, candidiasis, because you're killing off the acid in your stomach, and that's one of the primary protective mechanisms we have against yeast and bacteria, pathogenic bacteria. So yeast overgrowth, and from acid blocking drugs, birth control pills, another one. So that's why women have much more common to have yeast overgrowth than men, although men have it too. So the things that can affect, basically in many different areas of the body, but brain function, fatigue, brain fog, headaches, dizziness, irritability, mood swings, anxiety, sinuses, so sinus congestion, postnasal drip. You ever feel like this mucus just keeps going down? Chronic cough. If you're overly sensitive to perfumes and fragrances, or driving, people's exhaust or diesel trucks. So overly sensitive to that. Allergies, itchy ears. So this is, although this is most common in women, this is something that I dealt with years ago. And yeast overgrowth also is one of the more common cause with autoimmune conditions. So over and over and over again, patients I see so many patients with Hashimoto's and other autoimmune conditions, and yeast overgrowth and sensitivity is one of the primary drivers for this. And that is actually what I had, which caused my autoimmune conditions, which I was able to get cleared up almost 10 years ago now. So what caused mine? Well, my father was a medical doctor, so growing up, I was on a lot of antibiotics, like for every little sniffle. When I was like 7 years, 5, 6, 7, had chronic sinus congestion. So what's the antibiotic? That's what they give for that. So that was just wreaking havoc on my system. Ultimately, ended up getting my tonsils removed. And then that just kind of set the stages for all of these yeast-related issues and a whole bunch of other things. So some of the, getting back to sinuses, so I had the itchy, I would have my left ear, I would get itchiness in my ear, for some reason, mostly only my left. And whenever I would, as I got older, like have a glass of wine or have some bread or apple cider vinegar, which was supposed to be so healthy for you. Whenever I would have that, my ear would start itching. And that's all yeast related. Of course, I had, getting to the guy, I had abdominal pain, gas, bloating, diarrhea. Constipation is another cause, didn't really have that. IBS, yeast is almost always involved with gut issues that I see. And I certainly had plenty of that. Food sensitivities. So when you have yeast overgrowth, it can cause leaky gut, which then makes you more prone, increases the number of food reactions you have. And I had plenty of food reactions, gluten and many other foods. And as far as genitourinary symptoms, so vaginal yeast infections, of course, that's really all the medical profession really, the traditional medical profession only really recognizes yeast overgrowth is vaginal yeast infections, and they give you, a topical prescription for that. And that's pretty much the extent of that. They don't really believe at all or acknowledge that yeast can affect you systemically, except in severe cases and hospitalized patients, but it's really not on the radar. And if you even bring it up, patients tell me they're just like laughed out of the room. But with traditional medicine, it kind of reminds me of, like in the military, the old policy, don't ask, don't tell. It's like one symptom, one drug. You get past that one symptom and they don't want to hear anything. Or else you can get, but that woman had 38 different symptoms. Are they gonna give her 38 different drugs for that or something? Well, she did go to dozens of specialists. So, but anyway, skin issues, acne, sunspots, and this is something I had when I was in college. They call them sunspots, these white spots on your back and neck and shoulders. That's related to yeast, internal yeast overgrowth. And you can actually absolutely get rid of those when you get this yeast under control. Fungal infections on your nails, white coating on your tongue, eczema, psoriasis, skin rashes, itchy eyes, ears, or skin. One of the most common things with patients, the itchiness all over their body at night especially, and it's just driving them crazy. And when we put them on the diet we're going to talk about and some of the supplements, it clears up within a matter of a few weeks. It can start clearing up. Numbness and tingling, that's something I had plenty of. Muscle joint pain or muscle aches and pains, fibromyalgia type symptoms. Had plenty of aches and pains, autoimmune conditions, and then like craving sugar, alcohol, or bread. difficulty losing weight, PMS, those are other symptoms. I mean, there's even more, but those are the basic. That's enough for today, for those. And then, so what's the solution to this? We went over a lot of this symptoms. So basically it comes down to, number one, how do you even know if you have it? So in our 7-step functional and free program, but step 1 is doing a thorough evaluation, whole body health analysis, and that includes lab testing. And for yeast, if we suspect that, stool testing is very important because that can determine if you have parasites, yeast, bacteria, what type, what can help clear it up. So doing a thorough evaluation. And secondly, well, and symptom picture, symptom profile is important. As far as treatment goes, it's pretty straightforward and simple. So the diet, I'm gonna go over that. It's basically called the free diet, which the term I came up with because it's not only free of gluten, but free of the most common allergens, gluten, grains, yeast, sugar, soy, legumes, dairy, etc. And within this free diet is the Candida diet. There's also, other autoimmune paleos within this, and a bunch of other diets within this all in one. So you don't have to do a Candida diet. You don't have to do a gluten-free diet. You don't have to do a paleo diet. This encompasses all of that. So I've taken the best of all of it into one diet. So anyway, just in summary, and if you want a copy of that, I'm going to put a link below, phase 1 of the free diet. So just click on that. We'll be happy to send that to you. But just in summary, it involves avoiding starches and sugar, and even most fruit, because you're really cutting down the sugar intake. And you're right at the starches and sugars. That's what yeast thrives on. And what you're doing is eating plenty of healthy proteins, vegetables, plenty of healthy fats. Say 1 serving of fruit a day, and it's outlined in there. But that diet, what you're doing is hoping to starve the yeast, because yeast loves sugar and loves yeast, of course, like wine, beer, vinegar, and mushrooms, things like that, anything with yeast, and fermented foods even. And nutritional supplements. So there's diet, and then there's nutritional supplements. So what the one I like the best that I found over the years really works the best is a product. Our natural medicine formula is a product called Yeast Defeat. So that has different ingredients, herbs in it, and other ingredients that help kill off excess yeast. And then we have our probiotic line, so ProbioSupreme. That's so vitally important to getting the normal healthy bacteria increased in your gut. So between the free diet, the supplements, and there's most always other things involved as well besides that, because yeast can wreak havoc on your system. So we address kind of getting these other things under control as well. But basically, if you just follow the diet, that in and of itself can start helping you feel better. And then adding these antifungal supportive digestive supplements can help dramatically. So let me know if, give that a try. Let me know if you have any questions or any other things you want me to cover. And I'll put again, copy of the free diet below. Feel free to click on that. If you like this, click the like button. Feel free to share it with someone you know. Subscribe to my YouTube channel, which this is going to be on. And next week, join me next week. So I'll be covering another topic. So just remember, no matter what's going on, I know so many people that come in, and a lot of you out there have these chronic health issues, and you're just feeling terrible, just inside and out. But really, if you can get to the underlying root cause and start addressing these, and come up with some permanent solutions for these. If you identify the cause, then we can come up with solutions to help get these things cleared up. And your body does have an amazing ability to heal, so you can get better. And if you, like I said, have any questions, feel free to reach out, and we look forward to seeing you next week. Take care.